I know that
Yeah.
MGB is one of the largest hospital at home programs in the country. Tell me about some of the biggest challenges in terms of supporting those programs from a technology perspective.
Yeah, I mean, listen, there's some really great technology, and we will all have experienced this in our personal lives with wearable devices and the integration of, like, even for your scales at home into your healthcare, your health apps. So
Mhm.
many people already experience this. During the pandemic, though, I think that was the real growth of the hospital at home programs for us. And I think this is a trend, especially across the United States, is only going to grow. Our hospital at home programs are currently expanding rapidly at MGB. And we now offer home hospital at 5 of our hospitals. But you mentioned the challenges. The first has to be just some of our patients are super tech savvy, and some of our patients are less tech savvy. And some patients don't have the means to actually own some of the technology that would be required for a patient to have. So we need to figure that out. And what gets even more difficult in this space is Medicare and the private insurers may not continue to offer the same reimbursement rates for our patients receiving care at home. So we're trying to figure out how we can actually use digital technology to disrupt this space. And many of our digital solutions are less expensive. And so we're trying to sort that out. So that's probably the biggest thing. And we have some partnerships that we're working on with tech companies and other companies to see how we can offer patients in home the right technology so that they can have the best equitable technology to support their at home experience. I think this is going to have to be the future. We're never going to be able to keep up with building hospitals and beds. And I think that this whole concept of at home is a big one. And there's a lot of innovation in this space as well. So there's a lot of companies. I think that's the other challenge, is just to figure out who's doing some of this work and to partner with them and start trialing and piloting some of their innovations.